I'm Dr. Yongjin Kim. It's a great honor to have live surgery at this OSTEM online meeting. And this is just big show, so I'm a little bit nervous, but I will do my best. Today, I'll place multiple implant using OSTEM digital guided surgery system called OneGuide, and immediate loading will be done with the prefabricated abutment and provisional restoration. Before I start, I'll briefly explain the surgery plan and the reason why I will be using OneGuide system for this case. This patient is a 51 years old male patient without significant medical history. So this is pre-op photo, the frontal view, and lateral view, and occlusal view. So as shown in this slide, this patient has multiple missing teeth. So I plan OneGuide system. I plan digital guided surgery system with OneGuide system. So let's talk about the reason why I will be using OneGuide for this case. Usually, to overcome challenging cases, in this day, I usually use digital guided surgery system. So how can you place implant well in this challenging situation? Multiple missing cases or fully edentulous patient. And then, why should we place implant in ideal position and angulation? Why should we place implant well? Because malpositioned implant will cause unfavorable result in biomechanics and maintenance problem, and less aesthetic result in anterior lesion, as you all know. So I think digital guided implant surgery can be a good solution to overcome these cases. So these are my main reasons why I prefer digital guided implant surgery in challenging cases. The first one is virtual preoperative planning is possible. And then second one is minimally or less invasive surgery will be possible. And third reason is ideal positioning of implant for planned final prosthesis. And final reason is this one, easy immediate provisional restoration delivery for immediate loading. Let's talk one by one. The first one is this one. During planning, we can design the ideal final prosthesis. So as a result, we can get blueprint of final treatment result. So virtual mounting on the planning program and prosthesis design and implant placement plan can be possible. And then minimally or less invasive surgery can be possible. So like this, when using digital guided surgery system, sometimes we don't need to open the flap. But in case of some GBR or minor bone grafting cases, we can open the flap with very minimal incision design. So flap surgery was a blind technique. I am an oral and maxillofacial surgeon, so I hated blind surgery because flap surgery was a blind surgery. But in this day, I rarely open the flap, especially when using digital guided surgery system. If we can take three-dimensional information about bone, and then if we can make a good implant placement plan with virtual planning program, and finally, if we can transfer that planned position to our patient mouth exactly with very good digital guided surgery system, we don't need to open the flap. So some situation, minimal incision and selective flap elevation will be possible. Today, I will do some GBR in anterior implant after implant placement. So at that time, we can make very small incision design and selective flap elevation will be possible. The third reason is ideal positioning of implant for planned final prosthesis is possible. So the advantage of this digital guided implant surgery is restoration-driven implant placement. We can place implant to make a good prosthesis. That's quite a good reason. So we can minimize unfavorable result in biomechanics, and then we can decrease the maintenance problem. The final reason is easy, immediate provisional restoration delivery for immediate loading. So adequate precision of implant placement provided, prefabrication of prosthetic reconstruction and immediate loading may be possible. So in this case, to perform immediate loading, one-piece type provisional restoration, temporary bridge will be delivered right after implant placement. In this way, we can do immediate loading like this. So as shown in this photo, this patient has no vertical dimension. This patient is not using denture in upper jaw. So to familiarize this patient with newly established vertical dimension, we need provisional restoration. In the upper jaw, I delivered temporary RPD. In the lower jaw, I will use fixed type provisional restoration, bridge. One-piece type provisional restoration will be delivered to the implant for cross-arch stabilization. Let's see, to use OneGuide system, merging CBCT and surface scanning data was done. And then prosthetic design. Based on this prosthetic design, provisional restoration was fabricated and prepared. And occlusal view of prosthetic planning. And let's move on implant placement plan. In the molar area, I plan 5.0 diameter TS3 implant. The premolar 4.5, canine 3.5. Here, in the left canine area, there was pre-existing labial bone defect. So light depth implant placement, GBR will be done. And so after GBR, provisional restoration after GBR, abutment could not be connected. So I will place one more implant in lateral incisor area. So 3.5 by 10 in left lower lateral incisor area. And right side, canine area 3.5, premolar 4.5, and the molar 5.0. So to transfer this planned implant position to our patient mouth exactly, I designed this OneGuide template. So during surgery, we may experience some implant deviation or drilling deviation. So we should do something more to decrease this complication or surgical error. During data processing and merging, we can make some mistake. So I think the merging CBCT and surface scanning data is first step of digital guided surgery. So this merging should be accurate. When merging, when combining CBCT and surface scanning data, we should superimpose the teeth. So by superimposing or overlapping the teeth, we can make good merging exactly. But let's think about this case. If your patient has no remaining teeth or a few number of teeth are remain, what should we do? So we should consider something more. So some situation, we can put some radiopaque marker. We can attach some radiopaque markers on the gingiva. This radiopaque marker should be placed on the attached gingiva, unmovable tissue. But today, I will place implant in the mandible. Let's think about mandible. If your patient has no unmovable tissue, what should we do? So to overcome this situation, I usually use this technique. I usually place 1.6 millimeter diameter orthodontic screw on the alveolar ridge. And then over the head of this orthodontic screw, pull-up resin as a radiopaque marker should be attached like this. 3 or 4 orthodontic screws should be placed on the alveolar ridge. In this way, we can maximize the accuracy of merging. So we can get accurate result of implant placement. So in this case, in the upper jaw, I placed 2 orthodontic screws, and lower jaw, 2 orthodontic screws. And then over the head of orthodontic screw, pull-up resin composite resin was attached. And then during drilling, we may experience some deviation of drilling or deviation of implant placement. So because of poor guide stability. So OneGuide template or digital guide surgical template could be classified according to the type, tooth supported type, or tooth and mucosa supported type, and fully mucosa supported type. When using these two types, mucosa supported type or tooth and mucosa supported type, freehand case, we may experience some tilting, distal tilting of surgical template because of gingival tension like this. So once the drilling is tilted to the distal direction, the implant will be tilted to distally. So to avoid this situation, the surgical guide template should be fixated with anchor pin. Today, I will use 4 anchor pins to maximize the stability of OneGuide template during drilling and implant placement. So I designed 4 anchor pins hole. And then, as I said before, 3-3 area, left canine, I will do GBR with Smart Builder, 3-dimensionally freeform customized titanium mesh which can be connected to the implant. To use this Smart Builder, I will place implant first, and then after removing OneGuide template, I will open the flap selectively, and then anchor will be connected to the implant. And then bone grafting will be done, and to cover the graft material, this Smart Builder will be placed over the anchor. And then canine area, implant will be placed right after extraction. So there must be a lag of soft tissue. So to overcome that lag of soft tissue, transmucosal type GBR will be done with healing cap. So to fixate Smart Builder, I will connect healing cap. So the main advantage of Smart Builder is this one. We don't need to bend, we don't need to trim of Smart Builder. So because the Smart Builder is a 3-dimensionally free-formed customized titanium mesh. And also, in canine area, to make very thick labial bone, some situation we should make a bone exceeding the pre-existing alveolar bone. So extra socket overlay augmentation will be possible with this Smart Builder because the Smart Builder has very strong space making and keeping ability. So to regenerate labial bone with ideal thickness and ideal contour, I will use Smart Builder. So just like this case, thick and good contour of labial bone. And then by fixing Smart Builder with a healing cap, we can do non-submerged type GBR, just like this case. So for that reason, I will use Smart Builder. So like this, transmucosal GBR will be possible. Yeah, before starting my live surgery, I want to summarize live surgery plan. Right after extraction, right after lower remaining teeth extraction, 9 implants will be placed with OneGuide surgical template, and then GBR using Smart Builder will be done in the canine area, left canine area. And then after suturing, prefabricated CAD/CAM abutment and provisional restoration will be connected to the implant for immediate loading. So, yeah. So I'll start my live surgery and wish me luck, please. Thank you. Yeah, I'll start surgery. 보시고요. So before placing OneGuide surgical template, I will extract the tooth. 아프면 말씀해 주세요. Left lower canine was extracted about 2 weeks ago. Canine. I will remove the granulation teeth from the extraction socket. So in left premolar area, the entire buccal bone was gone. So I will place implant here, post premolar. Okay. The right lower canine, the labial bone was intact. Good. Blade. Okay. Granulation tissue was removed completely from the extraction socket. So I will place this OneGuide surgical template. Here. Yeah. The sitting is so good. 살짝 다물어 보세요. Yeah. We should check the gap between gingiva and the guide's inner surface of surgical template. There is no space, so it means the good adaptation. So I will fixate surgical template with anchor pins from the center. For even fixation, the drilling should be done at the same time. And then, 잘 눌러라.
크게 하세요.
살짝 다물어 보십시오. 빼보자. 잘 눌러. 꽉 눌러. And now I will fixate template with anchor pin. 물 끄자. Don't insert first anchor screw with full depth for even fixation. About 80% insertion, and second one, the right side. %, and one more in the left side. And then one more in the right molar area. And then even fixation. To prevent displacement of drills, stability of surgical template is most determining factor. And then, okay. Yeah. The stability of surgical template is good. Okay, fixation was done. Yeah, let's see the stability. Surgical template was fixated to the alveolar leads. from me, and then I will start the drilling.
다시 걸어드릴게요. 손오백으로 해주세요.
I will start drilling from the anterior side. In the molar area, I will place 5.0, so 5.8 guide hole was formed. In the anterior area, including premolar, I place 3.5 and 4.5, so 5.1 guide hole was formed here. Initial drill is most important. So, yeah, again, K9 and second premolar. Again, right K9. Right second premolar. In K9 and lateral incisor area, I couldn't make a full depth drilling with initial drill because of highly positioned lingual bone. So flattening drill should be used to get full depth drilling of initial drill. So this is a flattening drill. Yeah. By using this flattening drill, we can remove, we can grind off the cresta cortical bone, so we can connect abutment easily. Okay. And molar area, initial drilling will be done with this initial drill with wide guide better. Yeah. And then second molar. Okay. Suction. This is post molar. 잘하고 계십니다. I will use flattening drill first in right second molar area. Yeah, as shown, by using this flattening drill, we can grind off the cresta cortical bone, and then we can get full depth drilling of initial drill. So, from all drilling side, initial drilling was done, and then I will use OneGuide drill to place implant in the anterior area. This is a 3.5 by 10 for lateral incisor to avoid interference from the anchor pin. Drill extension should be connected. Up and down motion is most important. Okay. And K9, I will place 3.5 by 11.5. So Left side 3.5 by 11.5. The bone quality of our mandibular anterior area is so good. So I will use flattening drill one more time. Yeah. Okay. And then for full depth drilling, bone quality is so good. And I move on to second premolar. Second premolar area, I place 4.5 by 7. So 3.5 by 7 initial OneGuide drill. Okay, here. And then because the bone is normal bone, so I will do normal drilling sequence. This is 4.5 by 7. So let's move on to molar area. Molar area, I will place, in the first molar, I will place 5.0 by 7. Second molar, 5 by 6. So here, this is a 3.5 by 7 for first molar. And then here, right side. Here, right side, the full depth drilling was so difficult, so I will use this flattening drill again. In case of immediate implant placement, we should place implant deep enough. So highly positioned septal bone or lingual bone can be an obstacle for full depth drilling. Okay, good. And then this is a 5.0 by 7 for first molar. Right side. Yeah. And let's move to second molar. Second molar area, I place 60 millimeter length implant because of limited residual bone height to the mandibular canal. So this is a 3.5 by 6 OneGuide drill. Inside the taper kit, there is no 6.0 millimeter length drill, but OneGuide kit has 6.0 millimeter length drill. So when placing short implant, this OneGuide system, it will be quite good. And then 5.0 by 6 OneGuide drill. 아. Yeah, final drilling was done. By checking the amount of bone debris during drilling, we can expect the bone quality. So, I place implant 3.5에 10. 이리게이션 하고. I place implant from left lateral incisor. This is a 3.5 by 10. And then delicate depth control should be done with this picture driver. Yeah. 당겨줘. Stability is so good. 안 보인다, 거기 오른쪽으로. I will do depth control and hex positioning. Yeah. During second implant placement, I will leave this picture driver here. 3.5에 11.5. In this way, this picture driver can play a role to support surgical template during next second implant placement. Here, this is a 3.5 by 11.5. And then stability is good. Yeah. Depth control and hex positioning was done. And then I placed one more implant. K9. 이리게이션 해줘. Left K9 here. Then depth control will be done. Depth control and hex positioning was done. And then 4.57. I placed 4.5 by 7 in second premolar area. Yeah. Okay. This is another picture driver for 4.5 diameter implant. Stability is good. Yeah. Yeah, one more implant. 4.5에 10. 4.57. So I place one more 4.5 by 7 in left second premolar. Stability is around more than 30. 아프세요? 오케이. 며칠 좀 더 줄까?
조금 더 할게요.
리게이션 좀 해줄까? 왼쪽에 5.0에 7. And I'll place 5.0 diameter implant in first molar. This is 5.0 by 7, sorry. 바꿔줘. 아. 오케이. 5.0.
주시고요. 네.
Oh, the stability of implant is too high. So in this situation, we can experience the compression bone damage. So in case of hard bone, we should do oversized drilling. So here, I will use 5.0, 5.5 diameter drill. 핀셋. Picture was dropped. 오케이. 보관. 하나 더 줘. 5.0에 7 하나 더. Too much insertion torque will cause some problem.
손으로 바꿔주세요.
This is 5.5. OneGuide. And then I will try again. OH 50. 예. 5.0 맞아? 예. After using 5.5 drill, I could get appropriate stability. Not too much. 그리고 왼쪽으로요. Okay. And then I place one more 5.0 by 7 in left side. 아. 이쪽으로 돌려보세요. Unlike right side, this area bone is normal. Depth control and hex positioning was done. Okay. I place one more implant in second molar area, 5.56. This is 5.0 by 6. 하나 더. 괜찮으세요? 오케이. 하나. Okay. Then finally left second molar. 보시고요. Sometimes this picture driver can be locked. 키트 하나 더까?
아니요, 가이드 키트 하나 더.
잠깐만. 예. After counterclockwise rotation. Okay. So I will do more depth control here. Here, left side, the bone is so hard, so initial step insertion torque is too high. So I will do oversized drilling. So when drilling through the guide hole, we cannot get tactile sense completely to measure the bone quality. Okay. Because the surgical template was fixated with anchor pin, the implant removal is so difficult. Okay, 하나 더 줘. This is 5.5 by 6. 있어. depth control and hex positioning is done. Yeah. Then I think there was minor tilting in right second molar area during implant placement. So anyway, before checking the implant position, I will remove. In this situation, we should check the vertical position of this implant after flap elevation. So I will remove the surgical template.
50에서 리버스 할 거예요. 이제 리버스 할게요. 이렇게 뺄게요. 네.
몇 분 남았어?
25분이요.
응?
25분. 이렇게 뺄 거예요. 조금 크게 해주세요. 네.
안 돼. 안 풀렸어. 이거 제발.